Now let's talk money and resource utilization. DRS and our associated business practices saved Minot Air Force Base roughly $53,000 in 2010 and $105,000 in 2011 by streamlining the DOORS data entry process and eliminating the duplication of effort associated with DOORS reporting. Looking more broadly at the cost savings to Air Combat Command, we realized $817,000 savings in 2011, and as you can see, this effort has the potential for much greater cost savings. More importantly, DRS has a synergistic effect and vastly improved the effectiveness of our entire flight across all program areas. For example, in 2008-2009, our OEH data collection that we indicated as the dark blue on the previous pie chart was a sparse 5 field exposure assessments over a period of 2 years. In contrast, our 2010 and 2011 numbers skyrocketed to 151 and 156 field exposure assessments, respectively. These are exactly the exposure assessments that were needed for the Gulf War. By freeing up our time, DRS enabled us to better define health risks and personnel exposures. So now we're more confident that our installation's ventilation systems, PPE, and other risk control measures are effective at mitigating hazards. Additionally, DRS helped us eliminate 2 OSHA-regulated areas and improve the quality of our VA documentation. And speaking of the VA, these cost savings pale in comparison to the costly compensation claims or the $60 million per year Congressional Research Fund that resulted because of Gulf War illness. In conclusion, the Minot Bees are strengthening Air Force's health exposure documentation for over 100,000 airmen worldwide and are shaping the quality of health care to U.S. service members. With the help of ACC leadership, we have paved the way for standardized data entry and reporting of occupational and environmental health exposure data. During the Gulf War, if the DoD would have had an exposure tracking system like DOORS and a reporting capability like DRS, we would have been equipped to characterize exposures, diagnose and treat ailments, identify higher risk populations, better apply ORM, and institute protective measures and avoidance techniques. We are the Minot Bees, and we are helping to prevent the next Gulf War syndrome. At this time, we would be happy to answer any questions.
This concludes the team's presentation. This is the whole team. So,
on behalf of the entire panel of judges, thank you so much for your work. We're honored to hear from you today, and you've embodied the idea that good things come in small packages. What I'd like to understand are just a few details. I mean, you did a great job explaining this. But this 178 pages versus the 3 pages, is the 178-page thing, was that statutory? Was that mandated that you had to do that?
Sir, we're required by DoD 6055.05 to document occupational environmental health exposure data for our U.S. service members. It doesn't specify exactly what the form should look like. In USAF SAM, which is United States Air Force School of Aerospace Medicine, established business practices in 2009, which stated that the 125-page report is the exposure data form for the United States Air Force and is adequate for documentation in the medical record.
But after your development of DRS, you were released from that responsibility of doing the large one?
The key is, the way we interpreted the regulation was that it needed to be DOORS-based. And our product is DOORS-based because we actually load all of our information in the DoD system, and this is just a better means of getting the data out and making it more useful.
Okay.
And it's been accepted, and we've been identified by the Air Force Inspection Agency as the benchmark for occupational health reporting for the Air Force.
Now, you've been humble about this, and we appreciate that, but am I to understand that there's somebody or some buddies at Minot who developed this whole thing?
Yes, sir.
And who are those people?
He doesn't like to say. It was Colonel Silvers and Lieutenant Oakes. They got together They started with a blank whiteboard in their office, and they started figuring out which data points in doors they could use to pull into an Access database. And then after they got that, then they came up with these reports that when we as technicians and managers look at them, we could make sense of the reports. But he also went with, to all the technicians, asking them what they felt was important, as well as talking to the flight surgeons, public health, and other Team Aerospace members. But it started with Lieutenant Oakson and Colonel Sellers.
You've got a good wingman there. Thank you very much. General Bolton, your questions.
You showed tremendous initiative. I think this is outstanding. You were also, I think, very humble in discussing. I mean, the paper does a tremendous job of laying out specific savings. I love the charts. The one chart that kind of showed actual savings, and then green for realized, and then the pie chart to show what percent of time you're spending on the job versus reporting, and then with the 1% and 62%. In the paper, you didn't talk about this, but in the briefing just at the end, you talked about some of the less easily measured benefits of that time that you got back. And I'd like you to give you another shot at just kind of talking, if there's one or two or three big things that you want to say, because I think it's very important to simplify, save paper, ease reporting, but I think the real benefit was what you're able to do with the time you saved. And I think that's something you can be very proud of, and I'd like to give you a shot at it.
Okay.
Another shot at it.
Well, I mean, basically, the title of our presentation is Preventing the Next Gulf War Syndrome. I won't say the presentation over, but obviously, not having that exposure data resulted in a national problem.
Okay.
I think in some capacity, we lost the trust of the public and those families of the service members who sacrificed themselves for their country. And I personally know of individuals that came back from the first Gulf War and went through divorce and mental anguish. And I don't know if it was related to some other illness or Gulf War illness, but the reality was we didn't have the information to stand up and say, we collected the data, and we know that this is not the reason why they have this disease. Or, even better, we collected the data, and we know that there were risks, but we made a decision to put people in harm's way for the greater good, or to protect our people, as we knew it was right to do. So I think we would have had a stronger case as a DOD to maybe defend those. I think you understand. Thank you.
General Waldrop. Oh, excuse me. Go ahead. Please go ahead.
If I can add also, from a technician standpoint, our technicians were spending not as much time in the shops as they should collecting data. And some of that time was spent inputting data into doors, but we had to manipulate that data into reports that we could use. DRS enabled us to go spend more time out in the shops that we needed to. I mean, it's just, you have to be out there in the shops. The supervisors need to know you, and we need to be out there. So.
Thank you. General Waldrop, please.
Great job. Have you had any efforts or successes in changing the DoD policy that created this monster that you're trying to cut down?
I don't really see a problem with the DoD policy. To me, it seems entirely valid.
I'm talking about the 125-page report.
Oh, right.
Have you made any efforts to use your report as a replacement, for example?
Well, we have submitted our reports. We submitted them through Air Combat Command. And what they did is they took 4 reports because my Command B did not want to try to tackle a monster problem. He felt like we should focus. And so we focused on 4 reports. Those were vetted through all the MAGCOMs and were endorsed by Air Force Medical Services Agency and have now since been submitted to the contractor, the maintenance contractor for doors, as the future reporting suite for the Air Force. So have we tried to change the use of this document? We've identified it as a problem to all the senior leaders in my career field. And we were invited, as we mentioned, Sergeant Fisher mission, to to brief at the Senior Medical Leadership Symposium in Leesburg last year.
General Grosso.
I just want to understand this data thing a little bit better. So I'm trying to understand how you got from the, too much red to more blue on your pie chart. So are you entering the same kind of data, or are you entering less data? Because you're still using the door, so I'm trying to understand how you were able to get more blue.
We're entering the same data, but between being able to get the reports out a lot quicker, and then by getting the data in certain fields, we also created that DOORS field guide that says step by step what data fields you need to populate. So it really streamlined the amount of data that we needed to populate as well. So we did save time on both sides, inputting data as well as getting the data out.
Interesting. Thank you. Yeah.
Colonel Dolan.
Maybe you guys can write up a program to do our taxes a little bit quicker, too. Well done and a great presentation. I'm going to kind of go back to what Major General Bolton was talking about. And can you expand on any personal anecdotes of what you're doing with your extra time now?
I'll give one example. We have a combat arms training mission for heavy weapons training. And previous winter, or actually about a year and a half ago, about the same time when we started developing this system, we had individuals that were coming out of the cadre members who actually train our airmen on how to fire these heavy weapons. They were coming out of the heavy weapons firing area, and they were vomiting. And this came out during an inspection, that they were sick because of whatever's going on in their work center. We thought it might be lead dusts. So we ended up spending, well, we found out that it wasn't. It was carbon monoxide, and that they were being exposed to 900 parts per million. The level of carbon monoxide that can kill you is 1,200 parts per million. So we were literally exposing individuals to 900 parts per million while we're sitting away at our computers entering data in a management system that's not helping us. So we ended up spending thousands of hours. I'll say somewhere in there, we calculate all this, and we spent in the neighborhood of around 1,700 hours side by side with our CADM team holding measuring devices, working with them, because our commander said the mission must go on. We cannot shut down this range. We have to make it work. And so we actually were able to expand our operations, where we had to shut down the entire range, and then we were able to open up the entire range. So that would be an example of that critical exposure data, that if we're not doing our job, no one knows what the hazards are. So.
Great. Thank you very much.
Final question. Is this robust enough that you can move on to a new assignment and have this thing carry on?
I discussed this with Colonel Breed, who's the Command Bioenvironmental Engineer at ACC, earlier this week, and let him know I might be gone next summer. And we need some type of sustainment for this program. And the answer is no, we don't have that. So right now it's depending on our base.
All right. We are very proud to have heard what you had to say today. Thank you very much, and that concludes our questions.
This team has achieved monumental success in getting here today. They competed at local and MAGCOM levels to earn the right to present their success story to you. To recognize this achievement, we are presenting each team member with the Chief of Staff Team Excellence Award coin. Presenting the coin is our Chief Judge, Major General Dwayne A. Jones. Ladies and gentlemen, this concludes the presentation. Please join us in congratulating this team with a round of applause. Our next presentation will begin at approximately 1500. Please allow our judges to exit first. Thank you.